all that information out. Our hospital also was the first hospital in Australia to go completely fizzy drinks free, and our cafeteria is totally green. Yep, so that's a bit about that. So on our next slide is the project that was set up by WDHS. We've missed one. So there we are. No, they were not there. Which is our Helping Hands program. So this is a community-based program for people who requiring support during the COVID outbreak. And so what we're doing predominantly is we're doing the orders with the local supermarket for people, and then we use volunteers to deliver those home. We do medication deliveries, yeah, all that sort of stuff. And we do welfare calls. So if you go into the next slide, Suzanne, we do welfare calls every week. So currently we've got 120 people who are registered with us that we ring each week, plus we've got another 120 from our social support group that we do that for too. So we pay bills and all that sort of stuff. So this is our Helping Hands project, which is the people feel very well supported. If we go on to the next one. So what we also do is, as far as staff are concerned, is every week the hospital sends out this staff update, which tells us about what's been going on. We also have all staff weekly meetings on Wednesday. So we're currently screening asymptomatic as well as symptomatic people. We've got a drive-through screening, as well as all the staff are going through as well. So as you can see on there, we've done 594 screens. We're lucky in that we've got no known cases of COVID-19 in our area, which I think at the moment it's kind of, people are getting a little bit complacent and going back out into the community again. So it's a little bit interesting times at the moment. So that's our staff are kept well communicated with all that as well. Okay, next one, which is we've also now established another program alongside our Helping Hands program called the Big Hearts program, and this is to support people who have directly impacted by COVID-19 who normally wouldn't have been impacted before. So it's the people, younger Australians and women particularly, who are hit the hardest, who are losing their jobs, and how we can support that community. So if you go on the next slide, Suzanne, what actually happens is we've got a really supportive community that is always donating money to the hospital. They're fantastic. So this is our way of giving back to them. So our staff, the majority of our staff contribute fortnightly through their pay, and then the funds that we raise from that is distributed to organisations in Hamilton that support those people in need. So we identified places like Wadia, the employment agencies where people would go who normally haven't had to do that. And so we are providing finances for them so that they can help these people. So the staff receive reports on where their contributions go, how they're distributed, and it's also tax deductible. Okay, so as far as the community transport service goes, because normally we transport for a distance of about 200,000 k's a year, as you can appreciate, we're very isolated from the metropolitan area, and we would probably do at least 3 runs a week to Melbourne, which is a trip that takes a minimum of 10 hours for our drivers. But what happened with the COVID virus, we reduced our transportation to only providing transport for people who are receiving essential medical treatment. At our hospital here, we provide chemotherapy, but we don't provide radiation. So we've got clients who require daily radiation in Warrnambool, so we still continue to transport those. And so I have 50 drivers, and some of those have been seconded to our Helping Hands program doing the groceries and medication runs. But also the majority, a lot of my drivers are over 70, so they're now self-isolating as well. So I've found that this week the community transport demand has picked up again as the eye specialist in Warrnambool's opened up. So that's a little bit concerning. So I've had people that we've had to transport down there. Part of protection of our drivers, we set up a little tick sheet, which is on the next one. So, so we've got a little COVID-19 volunteer checklist that the drivers can go through there. We provide the driver with disinfectant wipes to wipe down the interior of the car and the door handles and stuff before they get in. They're provided with hand sanitisers and masks, given gloves, particularly for use when they've got to fill up the cars at the petrol bowsers. We only transport one person at a time in the car. Like today I had people who had appointments at the same time in Warrnambool, so I've had to send 2 cars, and the client sits in the back of the car, and they have to be able to independently get in and out of their appointment.
Jeanette, can I just stop you for just a second?
Yep.
Lyndon said his screen was blacked out. I just wanted to check if anyone else.
Hang on. Sorry, can you give me that again?
Lyndon said that his screen is blacked out. I just wanted to check with others if they can see the presentation. It's just the 1 second.
Yeah.
Yeah, look, I'm sure people can see me. I can hear the presenter, and I can't see anything. Hoping it is.
I can see Lyndon.
Okay.
Me.
Thank you. We'll go back. Thanks.
Sorry.
Yeah.
Okay, so that's just the copy of the checklist that we get our drivers to fill out. And I reckon I'm nearly done. So what's my last one done? My last slide say, Suzanne? Yeah, I'm done. That's me. So yeah, we've got a very forward-thinking chief executive. So he's always looking at ways to support the community and the staff and all that sort of stuff. So there we go.
Lovely. Well, thanks, Jeanette. That's a great overview, and what we have been, I guess, hearing over the last 3 sessions has been not so much the approach. Oh, hello, I can see people now. That's great. Not just in the approach, the variances in organisations and communities. I mean, you mentioned there confirmed case.
Yeah.
I know there's confirmed case across the state. I think that's probably been to other providers. So I guess you're facing different challenges there, aren't you, around complacency, like you said. So yeah, sounds like you guys are doing a great job, and well done. And thanks very much for that overview.
Lyndon, someone's just raised their hand, which I haven't done this before. So have you done it before?
I haven't raised my hand before.
So JD has. Yep. So can I'll let her talk. That would be good.
Right.
Sorry, it was a complete error. I hit the wrong button. I wasn't sure if I was on mute or not.
Okay, that's fine. Thanks. So we tested that then. Great.
Yeah. And look, what we might do, if it's okay, and I should have mentioned this at the get-go, if we could hold off questions, just make a note of those, and at the end we've got lots of time to ask the presenters each some questions relevant to their presentations, and of course anything else that is relevant. So thanks again, Jeanette. Now we've got Kit Murdoch, who I know Kit quite well. Kit works with CTST here in Tasmania and is the Quality and Safety and Communications Manager here with Community Transport Services Tasmania. So welcome, Kit. Thanks very much.
Thank you very much, Lyndon. Like Jeanette, CTST very luckily has a forward-thinking chief executive. Just thought I'd throw that in there. Okay, I'll just share my screen. Okay, can people see? I'll just take that away. Can you see that?
Yep.
Right. Yep. Okay. All right. So, as I said, my name's Kit, and I'm happy for Suzanne to provide these notes and everything after the meeting, so you don't need to take screenshots. Not that I think it's that mind-blowing. I'm going to talk about communication in the time of COVID-19, and it's pretty much the same as it is any other time. It's you ask yourself 3 questions, and so we said, who are our stakeholder groups in this situation? how do we communicate with each of those groups and what do we need to communicate. When CTST looked at who we needed to communicate, obviously clients was our number one, with aged care and disability client families being the most important. We've got also the representatives, families and friends, obviously. Secondly, we have staff at all levels, so and across all divisions. So this includes our service coordinators, our business services staff and our paid drivers. Volunteers, so that's both drivers and admin volunteers at CTST. And then others, and we had a list there for the community, the public, other providers, government funding bodies, and particularly the Department of Health and Human Services, which is our state department, and the Australian Department of Health. Next, we had to decide how we communicated for each group. So this was really according to the type and frequency of information that was required. So, for example, internal staff have to be kept up at speed at all times. So we've got high touch interaction with them, as I'm sure you all do, with phone, email, face-to-face and teleconferencing. And we've had, you know, the few usual sorting out teleconferencing, but we seem to have it working now. The management team initially communicated with staff at least once a week, the CEO once a week and other managers during the week as well. And the aim was that by communicating with our staff early and often and regularly, you know, you will get an email every Friday, so you know what's happening. That helped to establish trust and inspire confidence in the management team's decisions, and that we had things under control, and also eliminated opportunities for rumours or confusion. Certainly in the early days, there was a lot of speculation about what this would all mean. And we also added video updates now, so from the CEO and both managers, which just gives that slightly more relatable face-to-face engagement. Another important part with the volunteers, we had volunteers, as Jeanette did, over 70 who were compulsorily stood down and others who elected to stand down. We've continued to maintain that weekly contact with those volunteers who are temporarily not volunteering, so they don't feel like they've stopped being volunteers. They get the same communication everybody else does, and the feedback has been pretty standard that they really appreciate that. That includes a phone call from the coordinators just to make sure they're okay, even offering them our grocery delivery service for the over 70s if they need that. External stakeholders, we wanted them to know, but we didn't want to flood them with messaging, so we just send as required letters or emails as something specific changes that they need to know about. In terms of what, I guess that's pretty much, you know, very straightforward, that slide, and I'm sure it's the same for everybody really. The clear and concise, calm, professional confidence was a tone we wanted to convey all the way across, and particularly with funding bodies, the messaging that we wanted to convey was that we're an agile organisation, but also stable, rock solid. So I guess the main tip that I've got from that as the comms manager here is, if you're going to send emails out to staff or volunteers once a week, don't wait until that day or even the day before to decide what to share. Just what I do is I keep an ongoing list of things that we're going to share and then prioritise what's the most urgent each week. And I try not to put too many messages out in one hit, because otherwise that dilutes the message. Communication obviously is two-way. So I have tried to make it as much as possible a conversation. And I guess one thing that I've learned from time spent in publicity and marketing is the more human and relatable our communication is, the more people will connect with it and it will engage them. So this is the second to last slide. Sorry, it's just taking longer to say than I thought it would. The communication conversation principles. So the notes on this slide unpack each one of these, but I'll just say really quickly, with empathy, we're all in the same boat. So communicate in a way that just reflects a shared goal of keeping the community safe. Clear and concise. Look, we're all navigating constant changes, and the best way to cut through the confusion that some people are facing, particularly clients, is that the message has a single clear focus. Necessary. Obviously, it's important for people to know that you're doing all the hand hygiene things, but that can just be something that sits on your website. If you're writing to people, maybe you could do that as a small infographic. Everyone's being flooded with a vast amount of information, and people are getting more emails and letters than normal about this. So just we try to think really critically about what is necessary to be shared, and the clearest and sometimes the smallest way to communicate the smaller things. Honesty, transparency, which is the buzzword now. Look, the story we tell our staff and our volunteers is going to be our public story. So our staff are our greatest allies in any crisis. So we just tell them the truth. We talk about the risks and what we're doing to cope with those risks, and including where there are unknowns. If we have unknowns, we're happy to say, look, we don't know what will happen next with regard to this, but this is what's happening now. And just we tell them what we need from them, and the response has been great. Consistency. This is, again, what we're talking to about, talking to our staff and volunteers, providing this organisational source of truth for our staff and volunteers will impact the brand of the organisation out there, because they're the ones that will talk to our clients. So we just decided it's really crucial at this time to make sure everyone's on the same page and singing from the same hymn book, or rowing in the same direction, or whichever metaphor you like. We created a quick reference guide for staff, which included frequently asked questions from clients and volunteers, so that the messaging is really, really consistent across the board. And then be creative, which I guess is a little more about innovation than communication, but it is actually part of communication as well, because all the things that we're doing with other organisations, diversifying services, doing grocery or pharmacy deliveries, we are exploring what our purpose looks like. All of us, I mean, we, community transport, we're exploring our purpose in the light of this situation and how that uniquely positions us to provide solutions. So all these things that we're doing now, communicate them, because this will impact how our organisation is remembered and how our contributions are remembered through this time. And that's all part of the public face of our organisations out there. The last one is that we have processes in place to measure the effectiveness of our communication all the way through, so that we know we use all these methods to say, is it working? So whether that's quick weekly or fortnightly pulse surveys for volunteers and staff, just 3 or 4 quick questions so that we can benchmark how their well-being is tracking and how they're receiving, are they getting enough communication, Do they know the things they need to know? Feedback in terms of unsolicited feedback, and at the end there, invite questions. That's solicited feedback. So particularly staff and volunteers, but also consumers, we consistently say, please ask questions. There's no such thing as a silly question, just ask, we want to hear. Process success is, there's a lot of process changes that we need to communicate, procedure changes, and I guess the best measure of whether we're communicating that effectively or not is, are those procedures being implemented correctly? So that's one indicator of that staff communication success. And the client response will be an interesting measure, which is our clients, as time goes on and they can see our control measures in action, and perhaps as some of the government's control measures tend to relax a little, does the client response indicate that they have confidence in our control measures? So that's pretty much it for me. If you can leave the questions until the end of the session if you want to, Lyndon, or I'm happy to take questions now, whatever you want to do.
Look, what we might do is leave them till the end. I think that's important. If you've got a question, leave them to the end. We'll go through all that. But look, fantastic, Kit. And I guess I'm in that fortunate position to see what Kit's doing twice daily for the last 2 months now. So well done, Kit, and that's great. And I think one of the key things there, I think, takeaways that if you're going to do something, whether it be communication or whatever you do, you've got to be able to measure it. If you're not going to be able to measure it, it's probably got to question, is it actually worth it, even doing it? So I think, as an organisation, we did get some survey results back in the last week or so that sort of confirmed that that we're on the right track. So that's been quite good. So well done, Kit. Fantastic. Now we'll move on to Stephen Lewis, Community Support Service Officer Transport with the Nillumbik Shire Council. Great to have you speaking today, Stephen, and welcome.
Yeah, thanks, Lyndon. I'm going to take a different approach. I've got a document that I've supplied to Suzanne, and she'll be able to distribute that after the meeting. And I'll just touch on the points of that. Part of it will be a bit about Nillumbik, about our community transport service, and also about a review that was conducted of our transport service in November last year. So just for those that don't know Nillumbik Shire Council, we're 25 kilometres northeast of Melbourne. The suburbs that that are in that municipality stem from Eltham, a portion of Greensborough, Diamond Creek, Hurstbridge, right up to St Andrews. So with the community transport service, we're part of our community support services at the Shire. It's a small team. We deliver CHISP services, and some of those services on June 30 will cease to be delivered by the council. Community transport and our social support groups are the only two areas that will continue post June 30. So our meals, our domestic assistance, home maintenance, we'll move back into another provider. I've been with the Shire for about 8 months now. It's the first council I've ever worked with. And yeah, the community transport service, we have 3 buses that we utilise, and we use them to do our usual runs of shopping, social events. We have used them for medical as well, senior sits groups, those type of activities, social support groups. Those 3 buses, one bus is located up at Panton Hill, which is north of the Shire, and the other 2 are located at our Civic Drive headquarters. Our clients that we have, we're a relatively small community transport service. I have about 17 volunteers, and we've probably got about 100 clients registered with us, but we probably have about 70 active. that we transport. Yeah, the other service that we provide is what we call one-on-one transport. And that's where we get volunteers to use their own vehicle and we reimburse them for their kilometres. And that's predominantly for medical appointments or health appointments. Yeah, during the COVID crisis, our normal community bus service has ceased or been suspended, not ceased. But we're still running the one-on-one medical. The only difference is, as others have explained, that our volunteers are predominantly over the age of 70, so they've had to self-isolate. So during this time, I've been doing our driving runs for medical, and yeah, so, and like one of the speakers said before, this week we've seen a slight increase of the number of people that are willing to go back out into the community. Yeah, so similar, a lot of the things that other speakers this meeting and last meeting spoke about during COVID are things that we're doing. We're calling our clients. We're also instigated through our positive ageing group, letter writing from primary school students to the elderly who are isolated. And that's been responded to really well. Other things that I've been doing during this haven't been driving of clients, but our Meals on Wheels were lucky enough in the early days to be able to receive a load of toilet paper that needed to be distributed. So part of what I do is go and pick that up and then not distribute it, but take it to our Meals on Wheels office. Tomorrow, in fact, I'm going to pick up 500 kilograms of food that will go to a Christian church for distribution over the coming weeks. As I mentioned earlier, the transport service is very small, but the population in Nillumbik is about 64,000 people. There's isolated people, and the review was conducted with the view to try to increase and develop and utilise the service more than what it is at the moment. At the moment, the service is probably running at about 50%. And my role is to come in and try and grow that service. I've had 3 years previous experience with Whittlesea Community Connections in Epping, and have come in here to try to, one, promote the service and grow it, and also grow our volunteer base in the service. When I came in, we had in total about 8 volunteers running all of those services. So we've more than doubled that now. With the review, a couple of the things that come out of it were there really wasn't a direction. The council fully support community transport, hence the reason why it's moving forward July 1. But there wasn't really a strategic vision or a business plan for the service, or at least not a current one. So part of it is to develop a strategy, look at what our vision, our mission is, and then put in place some goals to achieve over the next 3 years. We want to build new partnerships with networks such as the VTCTA, and also other local councils and other groups that provide community transport. Budgets is another one. There's really no clear-cut budget. We get KISS funded. The council provide probably about 40% additional funding for the community transport service to operate. Our volunteers, the things we're looking at the moment are recruitment and retention and reward of our volunteers. It's probably a thing that hasn't been looked at closely enough, hence the reason why the numbers of volunteers had been low. We also need to find out what our clients want. There's no point providing a service if the service we're providing isn't what the cohort want. So we're using our positive ageing committees, our positive ageing officer, and our inclusion division to start to talk to people about what is it they really want in the form of transport. IT systems have also been an issue. We currently use CareLink, the transport module, and I'd be happy to talk to anybody who uses that and can understand the transport unit or module. Yeah, because we've got it, but we're not using it fully. Customer service satisfaction. The survey hadn't been conducted on our clients for a number of years. One rolled out in January this year, and the feedback is really positive. So people are liking the service. We've just got to grow it. And our processes and procedures. A lot of the processes and procedures were within the individuals running the service and not documented. We're now using a software program called ProMap to actually document and streamline our processes for all to be able to use, given if I'm not there or a transport officer is not available if they're ill. Yeah, that's probably the main things about the service. Yeah, it's great that we've got a group that we can talk to. I want to utilise that a bit more from my side, which I haven't in the past. Yeah, so like the others, if there's any questions, happy to answer it. Our offices are currently closed. Nillumbik Shire Council offices closed on the 18th or around the 18th of March. Every staff member's been working from home, and we've had 2 days where staff could go in and get essential items under a restricted process. So yeah, any questions, happy to answer. Thanks, Lyndon.
That's great, Stephen. Look, thank you very much. It's great to, again, to have a council provider presenting today, and hearing what you guys are doing is just fantastic, like all the other organisations around the place. So I really appreciate that overview, very thorough. Okay, so now we've got some time for some questions, and as I was busily trying to work out the Q&A function on the system we're running, so I think I've got that worked out. So we've got a couple of questions there. So I'd encourage people to use the question and answer function, and we will use our panelists to answer those questions. So first of all, it's a question from Barry. Is it possible to, oh, hang on, that's not a question, that's more of an instruction. Here it is from Heidi. It's I would be interested in what others are doing in regards to volunteer retention. So I'll open that up to maybe Kit. Is that something you'd like to lead with?
Yeah, happy to talk about that. I think at the moment the volunteer retention is the key for us has been continuing to communicate with them, and we've allocated a staff. We've had about I don't know the number off the top of my head, but more than 130 of our volunteers are not currently volunteering. We have staff who actually make telephone contact with them every single week, and because they're also getting ongoing communication about what our control measures are, we're actually finding now that we're having more of the under 70 group anyway. We've got more volunteers who are saying, you know what, we're feeling okay about this now, we'd like to come back, than we are having volunteers deactivate. So I'm spending more time reactivating them than deactivating them. And I think that's what it is. This is what we're doing to keep you safe. This is what we're doing to keep your passengers safe. We're professional about this. We change what we're doing if we need to. We look at what the government is saying on a daily basis, and it's just confidence in the organisation, I think, that's had that effect.
Yeah, if I just can chip in and add a bit more there too. So thanks, Kit.
Yeah.
I think one of the key things that we're doing is, I guess, going back to basics. Why do people volunteer? And they volunteer not because of your organisation. They don't really care so much about your organisation. They volunteer because they want to do something, give something to the community. So it's really tapping into that, the reason why people volunteer. And so really, I think it's important to remind people that their contribution is important now, and it will be again in the future. So you've got to really get focused on that main objective, and use the opportunity to upskill, training, online training, any courses you can sort of muster up, whether it be external or internal. I think is really important, and use that as an opportunity as well. Thanks, Kit. Stephen or Jeanette, would you like to add something there?
Yeah, I did, if that's okay, Stephen. So week after next is it's National Volunteer Week, so it's really important for us. Across Western District Health Service, we have 300 volunteers. So it's really important for us that we acknowledge the contribution that they make to us. So normally we have a big function that week, which of course we can't do. So what we're planning to do, we've got the certificates and the badges from Volunteering Australia, which we're going to give to everybody. But we also have an op shop as well. So we're going to emblazon that window, even though the shop's shut, with you know, every volunteer's name on there in a red heart. And we've got the staff who work with those volunteers to give us comments that we can put on there about how they're valued and all that sort of stuff too. So I think it's really important along the way that we, and everybody's the same, is that we reward and acknowledge our volunteers.
Yeah. And Stephen, thanks, Jeanette. And Stephen, I mean, you did mention that. Is there anything else you'd like to add before we move on to the next question?
Yeah, look, I treat the volunteers exactly as if they're a staff member. You respect what they do. I also catch up with them where possible every couple of weeks, and sit down and have a cup of coffee with them, take them to a cafe. Yeah, not at the moment, but yeah, and it's about taking an interest in them, not just the role that they do. It's about getting to know them, get to know the kids or the kids' names and that type of thing. Make it as personable as possible, and they want to volunteer because that's the type of person they are. That's they want to help. The other thing too is to learn what motivates them. What is motivating them to volunteer? Is it because they've had a family member who has been transport disadvantaged and want to do it? Is it because they're on Centrelink and they've got to do 15 hours of volunteering? Once you know those motivations, you can then tap into those motivations as well.
Now that's very good. Thanks each for those comments. And Jeanette, you've been requested a couple of times there for a copy of your checklist. So I'm not sure if you can see those questions, but that's something that Suzanne will be able to join the dots together after the meeting. So that's all good. Any other questions? We've got 13 minutes, so as we will do, we'll give people a bit of time to consider a question, and please use the Q&A function on your screen to raise the question. That way we can keep a track of all the questions for future.
Linda, can you see that question there from Heather about volunteer roles compared to paid staff?
I can't see that question, no. Sorry?
Okay. Heather Camilleri has asked, in reference to volunteers, are the roles that they do with community transport very different to what paid staff do?
And that question's to anyone particular, or?
No,
I'm happy to answer that. For Nillumbik, they're treated the same as staff. They get a lanyard with a swipe card on it. They can access the building. Yeah, there's nothing different that we do. The only difference is we don't pay them. You've got to treat them. If they feel like they're being treated differently than others, they'll stop volunteering. And in Nillumbik, we've got more volunteers in Nillumbik than we have staff members. there's about 500 people that volunteer in Nillumbik.
Yep, great. Thanks, Stephen. Anyone else? Jeanette or Kit? No?
I guess we're very mindful that a volunteer can't do with the job of a paid staff member. We have to be very careful that we don't cross the line there. But having said that, that the staff don't do the driving that our people do.
Yeah. No, very good. Okay, lovely. Thank you. Any more questions?
I can't see any more coming through, Lyndon. So the only other thing I wanted to mention was I quickly tried to put up a poll about who people would like to see present in the future. Hadn't done that before, so there's no option to type in it. It's only a multiple choice. So half the participants have answered that, which is fantastic. Keen for a little bit more detail if people want to send that through me as who they might be thinking specifically. Someone said they'd like a particular service. I don't know who's answered that, but if they could just type in somewhere who it is they'd like to hear from, that would be great. And peak bodies if they have any thoughts around which specifically they'd like to hear from. We don't know that we're going to be able to get them, but I will certainly try to get them. So, yeah.
That's great. Okay, look, we've got 10 minutes, so we might just give everyone a couple of minutes for any more questions before we finish up. But just one thing I think, I guess as a sector we need to start thinking about, and I'm sure we already are, is, and it's been mentioned a couple of times today, that consumers are, voting with their feet. They're assessing their own safety and well-being and against needing to get out and about and access services. So we are steady in some communities around the country, well, in Victoria and Tas, where are stepping out a bit more than others, and that's I think quite understandable. And I guess as providers, it's about how we, we're very good at, I guess, restricting service and bringing the service back and controlling the risk. And, we've done that down. And I guess it's now that we've gone through a few weeks of a settled phase generally or largely across the sector and all the community in general. And now we're starting to see a bit of a creep in, service demand. From consumers. So I guess as providers we need to start thinking about, if we haven't already, how we actually manage that creep out or step out, and what are some of the services that we are going to provide and how we provide them and what are the risks around that. So I guess it's just mindful that we have gone through a phase of reducing the service, making the service safe in that reduced model, and there's been some stability with that, but of course we're probably only halfway through the real, I guess, bulky, meaty part of this crisis management in terms of COVID-19. So thinking about the plans for the next phase, I think is really important as providers, and how we do that in a calculated and calm way, and of course how we communicate that as per Kit's presentation. So I just encourage providers to be thinking about that. If you're not, I'm sure we all are. Because that will, there's no doubt fatigue now setting in, guess what? We're only probably halfway through the real bulky part of the crisis management. So thinking about how we support our staff and how we manage that fatigue, I think is really important as well. Okay. No more questions?
No, there's no more questions there.
All right, we'll give it another 2 minutes, and if there's no more questions, then we will have an early 5 minutes.
Lyndon, I'd be curious to ask if people were keen to continue with fortnightly still at this stage.
Yeah, okay, yeah. I think that's a good idea, because I think we have just gone through a lull period, because we've gone through this really busy period of responding to this crisis, and then we've responded to it. I think that there will be another a challenging period as we start to move out. And I know at CTST, we're constantly talking about this. As we move out, there's going to be little outbreaks in some communities here and there. So how you manage that in community as opposed to in organisation is going to be quite different. So I think that fortnightly is a good thing personally.
Great. So quite a few people have responded that they're keen for fortnightly still. So that's fantastic.
Okay.
But I think that's all for now. I don't think there's anything further come through.
Okay, look, thanks everyone. I think well done again, Suzanne, for coordinating the session, and thanks for everyone for participating. Special thanks to our speakers that kept the standard really, really high throughout these sessions. So thanks very much for putting presentations together. I know they're well received. Definitely think about the type of speakers that you would like to have next fortnight. Please get that through to Suzanne as soon as you can. And any other questions that you have of the VTCTA or anything relevant, please send them through to Suzanne and we'll do our utmost to get back to everyone in terms of those questions. So if there's no more questions, I think it's goodbye for